I'm Parul Shukla. I'm the Regional Chief for Colon and Rectal Surgery for the Westchester region for Northwell.
Our colorectal program has grown quite substantially. We've had new physicians come in. There's a lot of energy, excitement.
The vision for our colorectal surgery program here in Westchester is to provide a state-of-the-art, comprehensive program that meets the needs of all of our patients.
We treat diverticulitis, Crohn's disease, inflammatory bowel disease, colon cancer, rectal cancer, amongst many other conditions.
I think our program really is a team-based approach, cutting-edge technology, cutting-edge procedures, meeting and surpassing the care some patients can get in the city. You don't have to travel to get that care.
You're not going to find any program that offers more than what we provide, from gastroenterology, oncology, medical, radiation, as well as the support services.
It's a very well-rounded approach so that the patient's getting the best treatment recommendation from every discipline.
Since Northwell became affiliated with both Phelps and Northern Westchester Hospital, there really is a seamless integration of care.
Relatively small hospitals, but we have some very advanced surgeons here that are offering really the full range of surgeries that one could find in the city.
Both of our hospitals have multiple robotic platforms. Our endoscopy centers are the very best.
We now have interventional endoscopists who do advanced procedures previously weren't available here.
One aspect of our colon and rectal surgery program that I think is really unique and special is our enhanced recovery protocol and our opioid-free anesthesia protocol, where patients don't wake up from surgery feeling groggy. They could just bounce back a lot faster.
We are one of the few programs where we are actually focusing on building teams in subspecialties. So colorectal cancer has its own multidisciplinary team. The inflammatory bowel disease team has its own specialists. And the pelvic floor program has its own specialists.
So colorectal cancer is the #3 cancer in the United States, so it's a very common problem.
We created a colorectal cancer program that includes surgeons, medical oncologists, radiation oncologists, interventional radiologists.
Here at Northwell, we're able to offer the most cutting-edge treatment as far as radiation and also the newest systemic therapy options, immunotherapy for patients with colorectal cancer. Every case is discussed in a multidisciplinary setting.
We all meet together and brainstorm how we can help the patient the best.
One of our aims is to actually try and impact on the incidence of colorectal cancer by enhancing screening.
Through appropriate screening, a patient has an opportunity to significantly reduce their risk of developing colorectal cancer. And colonoscopy is the most accurate, the most sensitive. It has the advantage of being both diagnostic and the polyp can be removed at that same visit.
We offer our patient not only the cutting edge of our knowledge, but we also want to offer our patient what the future brings in oncology. A very important part is having clinical trials available. So being diagnosed with colon cancer stage 4, it's not the end of the road. It's a lot of light in the tunnel.
We also provide, in collaboration with our gastroenterology colleagues, full surgical management of inflammatory bowel disease issues.
Within the colorectal surgery program, certain kinds of problems that really are amenable to having more of a wide spectrum service. So inflammatory bowel disease is an example of that.
We work very closely with our IBD experts, and in patients where medicine or medical treatment fails, surgical treatment starts. We are creating a digestive center which is going to be based at the Phelps campus, where the gastroenterologists and the colorectal surgeons will coexist in the same office. Patients can be seen by different specialists at the same time. They don't have to keep making multiple visits to the office.
The pelvic floor program is a very important component of the colorectal program overall.
Pelvic floor problems are common. They occur in both men and women, and they are a problem that is very often unattended to because previously there was not a lot to offer. And what we have brought to the community is a program with specialized diagnostic process, both surgical and non-surgical care, state-of-the-art sacral nerve stimulation technology. We have dedicated pelvic floor physiotherapists.
Patients who have pelvic floor disorders require the physical therapist to teach them how to regain their muscle contractions.
So, this is a particularly exciting program for us because we know that there's a need. Northwell Health has all of the resources, and they're dedicated to the needs of the colorectal department. We have state-of-the-art operative facilities, we have state-of-the-art hospital recovery facilities.
And we collaborate across the entire Northwell system to bring the best care.
So there is no limit as to what we can provide this community.
So whether you're in Westchester or you're in Manhattan or out on Long Island, if you're receiving care at Northwell Health, you're receiving the best quality.
There's a great benefit in that you have all of this in your own backyard. You don't have to travel to the city to get advanced colon rectal surgery care and advanced robotic surgery.
We have all the capabilities that someone would have in the city, and I think we're just providing great care for the patients here in Westchester.
Our colorectal surgeons are the best. I would like to say that it is always a privilege to be trusted with the care of patients, and I feel that that's what I'm most proud of.
Having the opportunity to provide better care to our patients is really what we're all about.
And this is what we want to offer our community.